In this video, we are going to explore important strategies, techniques in OET reading. So in today's lesson, we are going to work through one of the most challenging sections of the OET reading test, reading part C. Let me ask you something. Have you ever finished reading a passage, felt completely confident, and then discovered that you got most of the questions wrong? If your answer is yes, don't worry, you're definitely not alone. Here is what many candidates don't realize. Reading Part C is not testing how fast you can read, it's testing how accurately you understand the writer's ideas, opinions, and evidence. So, today I'm going to show you exactly how to approach this section like a high scoring OET candidate. Okay, let's get started. So before we start, remember these three simple rules. I call these as three golden rules. Rule number one, read with intention. So don't try to memorize the entire passage. Instead, you have to read the first question. Know what information you are looking for. Then you can read carefully until you locate the answer. And the rule number two is read every option. Never choose the first answer that sounds correct. Always compare all four options. Because in OET reading part C, two answers often sound reasonable. Only one is fully supported by the passage. Got it? And rule number three, understand, don't rush. Skimming and scanning work in some reading tasks, but not here. The questions follow the order of the passage, so you have to read carefully, understand what the author is trying to communicate. Got it? So let's begin with our first practice text. So this is an extract from Advances in Cancer Immunotherapy. If you want, you can just pause the video and read it. I will also read it for you. Cancer immunotherapy has emerged as one of the most promising treatment options in oncology, offering hope for patients with advanced cancers. Unlike traditional cancer treatments like chemotherapy and radiation, which target the tumor directly, immunotherapy works by stimulating the body's own immune system to recognize and fight cancer cells. This approach has shown significant success in treating cancers such as melanoma, lung cancer, and certain types of leukemia. Recent advancements in immunotherapy include the development of immune checkpoint inhibitors, which have transformed the landscape of cancer treatment. These inhibitors work by blocking proteins that prevent immune cells from attacking cancer cells. By removing these brakes on the immune system, patients' immune responses become more effective in eliminating cancer cells. However, not all patients respond to immunotherapy, and some may experience adverse side effects, including inflammation of healthy tissues and organs. As a result, ongoing research focuses on understanding why some patients do not benefit from these treatments and finding ways to improve their effectiveness. In addition to immune checkpoint inhibitors, other immunotherapeutic strategies are being explored. For example, adoptive cell therapy involves collecting and modifying a patient's immune cells to better target cancer. Another promising avenue is cancer vaccines, which aim to stimulate the immune system to recognize cancer specific antigens. These therapies are still in the experimental phase but show great potential. Despite these breakthroughs, cancer immunotherapy is not without challenges. The cost of these treatments is high and access to them can be limited, especially in low income countries. Furthermore, long term data and the effectiveness and safety of immunotherapies is still lacking, meaning that the full benefits and risks are not yet fully understood. So, this is the passage, and let's move on to the questions. The first question is, what is one major advantage of cancer immunotherapy? And you have options here. It targets cancer cells directly. It uses the body's immune system to fight cancer. It has fewer side effects. Okay. And the fourth one is it is effective for all types of cancer. Now it's your turn to identify the right option. Ready? The correct answer is option B. Let me tell you why. If you look at the first paragraph here, okay, in the first paragraph, the author clearly contrasts traditional treatments with immunotherapy. Traditional treatments targets the tumor directly, but immunotherapy works differently. It stimulates the body's own immune system to recognize and destroy cancer cells, right? So that's exactly what option B says. Now let's eliminate the others. Option A is actually describing chemotherapy and radiation, not immunotherapy. And if you see option C, it sounds attractive, but the passage tells us that immunotherapy can still cause significant side effects, right? And if you look at option D, it's another classic trap because the passage says it has been successful for certain cancers, not all cancers, right? So when you see words like all, always, or every, slow down and check whether the passage really supports such a strong statement. Okay, now let's move on to second question. What is one challenge associated with cancer immunotherapy? The options are it is too effective for some cancers, not all patients respond to it, it is available for free to all patients, it is only used in experimental trials. Now, which is the right option here? The correct option is option B. The author specifically says that not all patients respond to immunotherapy, right? And researchers are still investigating why. So option A is never mentioned. And if you look at option C, it is just the opposite of what the passage says because the treatment is expensive. But here it is given as free for all patients. That's incorrect. And option D is incorrect because immune checkpoint inhibitors are already being used. Only some newer therapies remain experimental. Got it? Now let's move on to another passage here. This one is the role of diet in managing type 2 diabetes. So, if you want, you can just pause the video, go through this passage, understand it, and then let's move on to the questions. Okay? Now, the first question here is according to the passage, what is the primary goal of managing type 2 diabetes? Option A to cure the disease, option B to control blood sugar levels, and option C to reduce medication use, option D to increase physical activity. Now pause the video and try to choose your answer. The correct option here is option B to control blood sugar levels. Now let's look at the evidence here. If you see the opening paragraph, right, the author explains that there is currently no cure for type 2 diabetes, right? Instead, the condition is managed through lifestyle changes and medication to keep blood sugar under control and prevent complications. Now let's eliminate the other options. If you look option A, this option A is again incorrect because the passage clearly states that there is no cure for diabetes. Option C, it may sound reasonable, but the passage never says the goal is to reduce medication. Medication is described as one part of effective management. And option D is another distractor. Physical activity is important, but it is only one component of diabetes management, not the primary goal. So, when a question asks for the primary goal, you have to focus on the author's main message rather than supporting details. Got it? And let's move on to the second question. According to the passage, what is one important benefit of the Mediterranean diet for people too with type 2 diabetes? The options are it helps improve blood sugar control and reduce the risk of cardiovascular disease. It completely replaces the need for medication. It encourages eating more processed foods. And the fourth one, it causes faster increases in blood sugar. Again, pause the video and make your choice. The right option here is option A. It helps improve blood sugar control and reduces the risk of cardiovascular disease. So the passage explains that research suggests the Mediterranean diet can improve blood sugar control while also reducing the risk of cardiovascular disease, which is a common complication of diabetes, right? Now, let's examine the distractors. If you see option B, this one is incorrect because the author never says medication is no longer needed. And if you see option C, it directly contradicts the passage. The Mediterranean diet reduces processed foods rather than encouraging them. Okay, and option D is also the opposite of what the passage says. The diet is recommended because it supports healthier blood sugar management. So remember, you need to watch for options that reverse the meaning of the passage. They often look convincing if you don't read carefully. Okay? So remember the three golden rules that has been discussed in this video and try to apply it in your OET reading exam. That's all for today's video. Kindly like, share and subscribe for more OET tips. See you in the next video. Bye for now.